Good afternoon, everyone. Welcome to today's COVID-19 update in Alberta. With us, as always, is Dr. Dina Hinshaw, Chief Medical Officer of Health for Alberta. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Before I begin, I would like to let Albertans know that we have made a small change to our guidance on swimming to allow indoor hot tubs, dry saunas, and steam saunas to open, provided enhanced cleaning, distancing between cohorts, and other measures are put in place. To date, we have not seen any cases linked to outdoor hot tubs or whirlpools, which have been open for several months, and other provinces like British Columbia have already allowed their indoor whirlpools and saunas to safely open without reporting concerns. Turning to today's numbers, we identified 113 new cases of COVID-19 yesterday. 43 people are currently in hospital, including 7 in intensive care. Alberta currently has 1,494 active cases, which is 91 fewer than yesterday, but still a concerning total. Sadly, I must report 5 additional deaths today. These deaths occurred in the last few days, and I extend my condolences to the loved ones who are forced to grieve during this difficult time. I know that schools and our current case numbers are top of mind for many of us. As I mentioned yesterday, we are doing media availabilities every day this week to try to answer questions to the best of our ability. To date, Alberta Health Services has confirmed 24 cases that were present at 21 schools while infectious. Since my update yesterday, as of this morning, Alberta had confirmed its first 3 school outbreaks, with 2 confirmed cases in individuals at the following schools: at Henry Wisewood High School in Calgary, at the St. Wilfrid Elementary School in Calgary, and at Chinook High School in Lethbridge. I want to stress that while we are calling these outbreaks, this is a very cautious use of the term. We are acting out of an abundance of caution by treating 2 cases who were in a school while infectious within a 14-day span as an outbreak, even when the cases are within one family. This is an extremely low threshold to meet. All outbreaks are still under investigation by AHS. There is no evidence of transmission within the school in any of these outbreaks. Rather, in each of these schools, there are 2 confirmed cases that were present in the school while infectious. We are striving to help parents have the information they need to best understand the risk of exposure that their children face. Anytime one confirmed case is identified as having been infectious while in a school, and any time an outbreak is declared, all parents and guardians at the school will receive a letter sent by AHS through the school. This is sent as soon as either of those situations is identified to ensure that those who are most impacted, the staff and families at the school, are informed of the outbreak, the actions that are being taken, and any next steps. It also ensures that parents with children can make timely choices about what this means for their family. We recognize that the public has a keen interest in this information as well, which is why the map was updated today to reflect these 3 outbreaks. We are committed to updating this map every weekday with information that we have validated as of that morning. Alberta is the first province in Canada to launch this kind of interactive map. I want to stress that the map is a tool to keep the public informed, but it is not the vehicle for alerting parents when there is an outbreak at their school. That is done by Alberta Health Services and the school. There will be times that parents are notified of a COVID case or outbreak at their school during the day, but the map would not be updated until the following afternoon, given our daily reporting timelines. We will be having ongoing discussions to make sure that our reporting process is meeting the needs of parents, teachers, and students, and are committed to making any necessary adjustments to provide clear communication about the risks in schools. As mentioned yesterday, this includes discussing how to post information about schools on a map when an alert with a single case is identified. Some stakeholders have expressed concern that this will unfairly violate patient confidentiality, especially in smaller schools and communities. We are currently working to find solutions to address these concerns. This is new for all of us, and I recognize that many Albertans want as much information as possible. I am committed to working with all of our partners to keep improving the reporting process around outbreaks and school cases. I am also happy to note that the provincial lab completed 9,711 tests yesterday. During the last week, our labs have averaged more than 11,000 tests a day, which is a testament to the incredible work that is being done day in and day out by so many people. Alberta's first official case of COVID-19 was detected by the labs on March 5th. Many have asked whether it was possible that cases went undetected before this time. In the past, I have said that it is possible. With any virus, including influenza and H1N1, only a fraction of the cases are detected by the health system, often because individuals don't seek treatment or experience symptoms so mild they are not even aware they had the virus. However, it is important for us to understand when the virus began spreading in Alberta. That is why earlier this summer, Alberta Health Services and Alberta Precision Laboratories undertook a retrospective study of more than 23,000 samples that were originally taken for other respiratory illnesses. This additional testing did not impact lab testing turnaround times in the rest of the system. These samples were originally collected between December 1st, 2019 and March 7th, 2020, 2 days after the first case was detected. From these more than 23,000 samples, I am pleased to report that we detected only one case of COVID-19. This was from a sample collected on February 24th, 2020, 9 days before our first detected case. The individual had returned from travel in the United States and was originally tested for influenza, not COVID-19, as Alberta had not yet expanded its testing criteria at that time. We did so just a few weeks later, the first province in Canada to broadly expand our travel testing approach. The fact that we found only a single retrospective case and that it was detected not long before March 5th is positive news. As a comparison, similar retrospective testing from China is reported to have found a first case in November, almost 2 months before official confirmation. Similarly, France's retrospective testing has found that its first detected case was actually collected in December in someone with no travel history. Our results highlight the strength of Alberta's pandemic preparedness and our response in the early days of this pandemic. From where we stand now, I have heard Albertans' concerns about the length of time it is currently taking to get their test results back. We are working hard to streamline every facet of the testing and notification process to reduce wait times across the province. That is why today I am pleased to announce that Albertans can now get their COVID-19 test results, positive or negative, through text messages or through an auto-dialer phone system. Albertans will be able to select their choice of notification options when they book their appointment with Alberta Health Services. This is in addition to the existing auto-dialer system, previously used only for negative results, and, of course, the option to access records on My Health Records online. It's important to note that those who test positive for COVID-19 will still be contacted by phone by an Alberta Health Services public health professional for follow-up and case management. The text messages or auto-dialer option simply give people the ability to be notified as soon as the lab result is available, with the follow-up phone call for positive results to ensure that people understand what to do to prevent spread and to complete contact tracing. Also, if you opt in to receive a text message, you can receive your test result anytime, day or night, as soon as the lab result is available. Parents and guardians will also now be able to consent to receive automated test results for dependents. Each individual test result will be delivered by a separate call or text. This is another step forward and will help us get test results to Albertans quicker, which will be vital to limiting the spread of COVID-19 in the coming weeks and months. I encourage all Albertans who arrange for a COVID-19 test to sign up for the results approach that works best for them. This notification is only one part of the process, and we are working to expand capacity and speed in other areas as well. I hope to be able to share more in the coming days. I know this is a challenging time, but I want to remind Albertans that we have dealt with uncertainty and overcome rising case numbers before. The solutions remain the same. Our public health system must be nimble, watching the spread of the virus closely and responding based on the best available evidence and epidemiology within the province. And we as citizens must each do a little more, take a little more care to reduce the spread of COVID-19. The day-to-day choices that each of us make matter. We have the power to slow transmission in our communities if we all work together. Thank you, and I'm happy to answer any questions that you may have.
All right, we'll go to the phone now. In addition to Dr. Hinshaw, we also have Andre Corbould, Deputy Minister with Alberta Education, who is also available to answer questions. Operator, could you put through the first caller, please?
Yes, thank you very much. The first question is from Bill Kaufman, Post Media. Please go ahead.
Yes, Dr. Hinshaw, I'm just wondering if there's any indication by now of the effectiveness of the mandatory use of protective masks in the larger centres in Alberta, because it's been about 6 weeks since those mandatory orders came into being.
The question of the impact of mandatory masking policies is a challenging one to evaluate. Of course, it's not possible to know what the trajectory would have been like if the order had not been put into place. And so all we are able to go on is, again, looking at the information that we have. We are seeing that transmission that's being reported and the trends that we're seeing are typically not in public spaces that would be impacted by the masking orders. So we are seeing again, social gatherings. We're seeing, places where people are getting together, not necessarily in a business, but in a home or in a private function. Those are often where we're seeing these, whether it's outbreaks or small clusters of spread. And we wouldn't expect those kinds of gatherings to be impacted by the masking order. So it's difficult. Again, we'll never be able to say precisely because we can't measure what didn't happen. But the importance of all of us using every tool at our disposal every day to think about how we can reduce the spread of COVID-19. Again, that includes masking where distancing can't be reliably maintained. It's all of those things layered together that will help us to continue working on reducing our numbers and making sure that we can keep our province as open as possible with respect to businesses and activities, while at the same time limiting the spread of COVID-19.
Operator, can you put through the next question, please?
Thank you. Jeff Slack, 660 News.
Hi, Dr. Henshaw. There was a letter from the principal of Henry Wisewood High School saying they consistently observed students outside the building not following the 2-meter distancing rule or keeping their masks on, and there was a lot of general touching going on both sides. This, and there was also a video yesterday of crowded hallways in schools. I'm just wondering if there's any plans to put in place kind of stricter measures in school to help reduce the risk of students transmitting the virus to others.
I'll maybe comment and then maybe ask Deputy Minister Corbould to add to that. Our school guidance is really focused on the areas of school where the teachers and principals, the staff, have the ability to manage the movements of students. We have heard reports from other sources that what students do after school is over is concerning, that students are congregating, perhaps sharing drinks. I think that, again, the important thing is that all of us, whether students, parents, teachers, staff, or anyone in our communities, that each of us needs to take the responsibility for making sure that we are not in a position where we could either acquire COVID-19 or pass it along if we should get it. And so schools can do a certain amount, and then really the rest of us need to pick up that responsibility outside of the school environment and carry it forward. So I would really encourage parents, particularly parents of students who are in junior and senior high, to have those conversations with their kids like they would about any kind of situation where peers might be doing something that for that particular family would be concerning. In this case, undertaking activities that put people at risk of COVID spread. I would really encourage parents to have those conversations with their kids and think through scenarios. What would options be for those kids? How could they respond? How could they be leaders in their peer groups to take responsibility for stopping COVID spread and being part, whether or not those students would be at high risk for severe outcomes? There are others in their lives who would be. So again, I think that's really something that each one of us needs to think about. How can we, outside of those formal environments like a school or a business or another structured place, how do we in our daily lives, each of us pick up that commitment to be a part of this bigger whole and care for each other? And I'll maybe ask Deputy Minister Corbould if he has any additional comments.
Yes, thank you, Dr. Hinshaw. I did want to comment specifically on, we do hear about some of these cases, and in each case we are in communication directly with the superintendents and the school districts to talk about them and see if there's anything else we can do to help alleviate these circumstances, either through better clarity, more communications, or whatever needs to happen in the schools. So additionally, the minister held another discussion with all the education partners yesterday. This was a part of the discussion. And we discussed the issue and how it can be resolved and what concerns superintendents and board chairs had in those scenarios, and described several solutions of how we can alleviate that. So it is being discussed, it is being worked on. And finally, I would just say that the protocols that we have in place within schools are being effective in schools. I would say that if you follow those protocols the moment you leave the care of the school, that's a positive action to take. And so we would certainly encourage students to follow as much as they can the same protocols outside of school that they're following in the classroom and in the hallways.
All right, operator, could you put through the next caller, please?
Yes, the next question is from Julia Wong, Global News.
Hi, Dr. Hinshaw. Just hoping to get some details on the man in his 20s from the Edmonton zone who passed away, whether he had any underlying health conditions. And wanted to ask a bit more about that case that predated the province's first confirmed case. Should the province have been more prepared with telling people to self-isolate? And could we have spotted that first case earlier? Because those who had been traveling to China were told to self-isolate in February. Those traveling to Iran were told to self-isolate in early March, but not those traveling to the United States until later.
With respect to the first question, we, of course, don't comment on individual cases due to confidentiality in any detail. But my understanding is that the individual did have chronic conditions. And, of course, any death at whatever age from COVID-19 or any other cause is, of course, a loss to family and friends. And so whether an individual is in their 20s or older, it's always a loss. And I, again, would want to express my sympathies to family and friends, both of this individual and all those who we've lost to COVID-19. With respect to the second question, I think that we reacted appropriately given the information that we had at the time. The individual who returned from the United States, again, we have no indication that there was widespread transmission. With 23,000, more than 23,000 tests and only a single case identified, what I think that tells us is that our criteria for testing, that we did at first focus on testing those who'd returned only from the area of concern in Wuhan and then expanded as our knowledge of the epidemiology of the disease and where it was spreading expanded. So, I think that the reality is that having missed only a single case of COVID-19 in any individual who was ill enough to seek medical attention, I think is a remarkable accomplishment, and I do think that it highlights that the decisions that we made and the timing of when we did expand our testing availability to all travelers and then to all who had symptoms was appropriate, and we were the first province to expand our testing to all travelers very early on, because we did start to see that there were cases coming from countries that we didn't otherwise anticipate. So again, in my opinion, having just that single case really validates our approach.
All right. Operator, could you put through the next question, please?
Eva Ferguson, Calgary Herald.
Yes, thank you very much, Dr. Hinshaw. I just wanted to jump back to the situation at Henry Wisewood High School in Calgary. So I understand from parents at the school that it was declared an outbreak at about 5:30 yesterday afternoon, which was the time at which the letter was sent to parents from Alberta Health Services. However, nearly 24 hours later, this case still does not appear on the online map that you're speaking of. I'm looking at it on my computer right now, and I'm refreshing, and the map still declares no outbreaks have been recorded. So I've been asking, and I've been told by a comms person the site would be updated today at 3:30, so that hasn't happened. And then when I look at the site more closely, it says it will only be updated Mondays, Wednesdays, and Fridays. So I'm wondering, since we have this map and Alberta Health Services is sending out the letters anyway to parents, why wouldn't you update the map as soon as you send the letter? And more specifically, I want to say, unlike businesses, schools are central to communities. Many high schools specifically share space with libraries, recreational centers, community centers. So wouldn't it improve vigilance and safe practices to reduce COVID in the community by providing this information about outbreaks to the entire public as soon as Alberta Health Services has it?
Thank you for the question. First of all, I want to say that we originally had intended to have our outbreak reporting in schools more frequently than the outbreak reporting that we currently provide on Tuesdays and Fridays. So we had originally intended to update on Monday, Wednesday, and Friday, as you note. With the increasing interest in schools and recognizing that there was keen interest in knowing in a timely way where we were seeing these outbreaks occur, we have worked with our analytics team to be able to do those updates every day. It does take some time to work on the coding and the ability to pull the information and get it into our system. And I want to just, again, acknowledge the tremendous work of our teams who do the challenging work behind the scenes to make sure that our websites, both the school one and all of our other ones, pull information in that is accurate and timely. And when we do that from the Ministry of Health, this particular school website, what we need to do is use the information that's validated as of first thing in the morning, and the team then works to incorporate that into the map that's updated that afternoon. And our first priority in having any kind of an exposure identified in a school is to notify parents, students, and staff at that school, as they are the ones who are most impacted. And that happens immediately. As you said, that letter that you referenced went out yesterday to those individuals who are most impacted by that particular exposure. In the case of these outbreaks that we're reporting today, there are 2 cases that were infectious while in the school. That does not mean that there's widespread transmission in the school. That does not mean that anyone who is in that school environment is at risk. And it does not put the rest of the community at risk. So in terms of timeliness, we really focus on timely reporting to those who are part of that school community. And then for public interest, we will report on a daily basis. Every afternoon, every weekday afternoon, we will be updating the site with the information that's been validated as of that morning. So as you say, there will be cases where parents may get a letter later in the day when something's been identified. That will not be updated on the site until the following day, because again, those who need to know for taking action will be informed either by that letter or by phone call if they're identified as a close contact of that case. And the website is a metric to be able to let the general public know what the impacts are in schools with respect to COVID-19, but it is not a means, it is not a tool to inform those who need to take action. That is being done by direct notification in a timely way.
All right, we can go to the next caller. Certainly, Eva, I can confirm that the website has been updated, although we're happy to double-check that after the veil to make sure nothing's gone wrong. Operator, could you put through the next question, please?
Yes, thank you. Jocelyn Laidlaw, CTV Calgary.
Hi, Dr. Hinshaw. Thanks for taking my question, and I apologize it takes you back inside our high schools again, but setting aside what the students are doing outside once they leave those school halls, yesterday we asked you about video from inside our secondary schools that shows crowded halls and not everyone masked in all circumstances. I know you hadn't seen the video at the time. It's now out there. The public has seen it. I imagine you've had a chance to see it. Video from Western Canada this morning from Henry Wisewood, also from Notre Dame School. I'm wondering what your reaction is to scenes of students crowded into stairwells and hallways, shoulder to shoulder, not everyone masked. What is your reaction to that, and what would you say to students and parents who tell us today they feel ill sending their children back into those kinds of conditions and scenarios, knowing that there are at least 2 cases in Wisewood in particular?
First of all, I absolutely recognize that this is a time of a lot of anxiety for parents and students and teachers as we're all figuring out how to move into this new normal in schools. I know that there's an adjustment time period, and the images that you're talking about, unfortunately, I think there's room for improvement. And what I would say is whenever any of us identify situations where we can do better collectively, let's together think about opportunities for how each of us, whether that's students in the school, whether it's parents working with administrators, how can we find solutions to those issues? If there's overcrowding, where are the ways that other schools have found to reduce that? What are those interventions that work in these contexts? And it's not easy, and I recognize that administrators and teachers have been working for months to try to prepare. Sometimes there are things that happen that then need adjustments to the plan. And so, I really think that when things like this surface, whenever there's any issue that surfaces that showcases where our current response is there's room for improvement, if we collectively say, how can we work together to improve this? Let's get the students involved in thinking about solutions. Let's get the teachers and the administrators involved, because ultimately, I think the more that we feel like COVID restrictions are being done to us and we want to push back against them, that doesn't set us up for success. I think we need to consider how we collectively pull together to defeat COVID, and that includes our students. It includes thinking about how do we empower them to try to come up with solutions to make themselves a part of that solution in the school. And I'll just check and see if Deputy Minister has anything he wants to add.
Yes, thank you, Dr. Hinshaw. Yeah, I just wanted to confirm that the protocols in all schools are very clear, both on the school reentry and the medical protocols that are happening in the schools. And if there's circumstances where they're not being followed, we have to do better, and we have to improve constantly to make sure, particularly with things that are very specific, like wearing a mask in a crowded hallway, we have to help the students understand the importance of it, and we have to work harder on those pieces. I also just want to acknowledge how important that the school boards, the staff, the teachers, they've been doing a tremendous job at doing exactly that, improving, following the protocols, explaining the protocols, understanding the protocols. And so there's continued work, and I'm confident that that will improve in short order.
All right, it's past 4 o'clock, so we've got time for 2 more questions. Operator, could you put through the next caller, please?
Carrie Tate, Globe and Mail.
Hi, thanks for taking my question. This is for the Deputy Minister again. I'm hoping you can expand a little more on filling in the gaps on when students are staying home for those 2 weeks of isolation, or how it may work as they bounce back and forth, as they toggle back and forth between schools. Will there be extra resources to guide those students who are then doing online for 2 weeks? Is it going to fall to the teachers? I know yesterday you said it's up to the school boards, but I'm hoping you can clarify a little bit more of your expectations.
Yeah, certainly. So first of all the school boards are prepared for some online instruction from the school because many parents have chosen not to send their kids to school, which is a choice and a right they have to do with our reentry plan. So there are several thousand kids who are learning from home, and so schools are prepared. They're going to use those same systems when there's cases where schools have to go back for 14 days. In terms of resources, I will take the opportunity to confirm that most of the money that the federal government has provided to help with safe school reentry has been delivered to the schools. The cash transfers were made this week. We confirm that all metros have received that funding. We have not yet received the federal funding, but Treasury Board and Finance have approved that that has been forwarded to schools directly this week. And so there are additional resources in schools, and schools have always had the ability to expend those resources since they got their formal letters of commitment for how those funds were going to be dispersed.
All right. Operator, could you put through our final question, please?
Thank you. Yes, the final question is from Joel Senek, Global TV Calgary.
Hi, thanks for taking my question. Dr. Hinshaw, you always said that there were going to be cases of COVID-19 in schools. So I'm curious with 24 and 21, is this about what you expected, or are you concerned with the amount you're seeing in this period of time?
I would say that the cases we're seeing are, again, a reflection of the fact that community transmission in some parts of the province is higher than I think would be ideal. So the cases that we're seeing in school are a reflection of that. And it's really important, again, that we all collectively do our part to minimize the spread of COVID, because if community transmission rates go up, we will have more exposures in schools, and if we're able to bring community transmission rates down, then we will see less exposures in schools. Again, it really is just a reflection of what's happening in the community. And what I think will be really important as we go forward, we'll be watching the outcomes of these particular cases, because we have been very conservative in our approach in terms of preventing spread in schools. And over the coming weeks, I think we'll be able to see the effectiveness of the school prevention measures and be able to understand more about what's happening within the schools in terms of transmission. And again, right now, we have not seen transmission in schools at all. What we've seen is a reflection of increased spread in the community showing up in schools, which again is not surprising. However, it is again a function of the fact that our numbers have risen in the past several weeks, and we collectively can make our schools safer by working together to bring those numbers down.
Thank you all for joining us. Dr. Hinshaw will provide another update tomorrow afternoon. Have a good day.